We're doing a craniotomy to remove a benign brain tumor.
Dr. Kimberly Hoang is an Emory neurosurgeon who specializes in brain and spinal cord tumors.
Yeah, it's good. You're anterior to it.
Hoang tackled the 7-year residency after med school,
Carrie, can you switch over for some tack-ups?
regarded as the most challenging in medicine.
It can be very dangerous.
Today, she is a leader in her field,
I have a strong suspicion there's going to be some radiation involved in this situation.
surgically treating people with life-threatening and terminal diagnoses.
It's right on the edge there, so we should encounter a tumor pretty quick.
It's a massive job.
Be super careful, though, by the vein.
It's not her only job.
Yeah, correct.
We had a news release at Georgia Tech about these tiny robots that can move. They weren't really doing anything. They were just moving around.
All right, Tony, so you can go ahead and run the video.
She saw the news release.
Right.
And then she contacted me, sent me an email, and I was like, oh, a neurosurgeon.
A neurosurgeon who majored in chemical engineering in college, who grew up in Detroit, Michigan, working on cars with her father, and thought she would become an engineer like him. Watching her mother go through breast cancer piqued Juan's interest in medicine, and this young woman, who was always good with her hands, including competitive piano, found her calling in neurosurgery.
I did the rotation and it caught me by surprise how much I loved it.
Joining the 6% of female neurosurgeons in the country.
So microrobotics, or our tiny little robots, basically, and that's our area of expertise for this project.
Gradient and fields.
And we haven't even taken into account yet the divergence.
It's been 4 years now since Hoang forged a collaboration at Georgia Tech
Yes.
Get rid of the CT scan.
with electrical engineer Dr. Azadeh Ansari
I think this is already very complicated.
and PhD student Tony Wang,
Oh, it's our cities.
combining her clinical knowledge treating patients with tumors
We have a coil for the X direction.
with their engineering expertise and her engineering background. Their goal? To bring micro-robotics to neurosurgery.
And oh, she's great. She knows, she gets all the details because I think of that engineering background.
You see a small line here and a small line here? Those are our robots.
Smaller than a millimeter, about the size of a particle of dust, these micro-robots have the potential to do biopsies, microsurgeries, carry microsensors, and deliver targeted drugs such as chemotherapy to deep regions of the brain.
What you see right here is the screw structure that's 3D printed.
Right now, tumor patients usually take a pill or receive chemo intravenously.
The trouble with that, as we know, is that there's this thing called the blood-brain barrier, which prevents bad things from getting to our brain. So that's great for our brain, but also prevents things like chemotherapy that we want to get to the brain from really being effective. And that's why surgery and radiation have been the mainstays of brain therapy, tumor therapy for so long.
With the micro-robot, drugs would be delivered directly to the tumor via a hydrogel backpack that is part of the robot.
Once the microbots get to the tumor or the desired area, there is a change in pH. And so that hydrogel backpack responds to the change in the pH, swells, and releases, in our case, these tiny nanoparticles that have the drug associated with them.
Hoang and the team give a demonstration of these untethered, steerable robots, magnetically controlled, that can travel over the uneven surface of the brain, drill through brain tissue, and swim within the fluid-filled ventricles.
Underneath the microscope, we can see how the micro-robot is moving.
And this is controlled actually via a joystick that the surgeon is controlling, and you can see how complex the trajectories we can do with our microrobot and how much control we have. Here we're spelling out GT for Georgia Tech.
As with all research, success is not a straight line.
We can use our controller or joystick to program unique magnetic fields inside our coil system to control our robot to go wherever that it wants to. The failures, I had to gradually reshape my mindset from seeing them as failures and more as like ways to learn and continue to improve my project.
This is life as a physician-scientist, treating patients and pursuing scientific discovery to improve that treatment.
I think the ability to help more than just that patient in front of you is a good reason to think about being a clinician and a scientist.
The Association of American Medical Colleges reports that 14% of all physicians do research. In academic institutions like Emory, 24% of physicians are scientists. Women make up a third of that.
And then you can ask, like, well, why not just be one or the other? You know, why try to bring it together? And that is challenging because obviously those are can be two full-time jobs in and of themselves. And so you're sort of splitting your attention, so it's hard to be good at both, and that's a challenge for all clinician scientists.
Also a challenge, the several weeks each year Dr. Hoang spends writing grants.
Writing a grant is like a very large book report.
Physician scientists need to fund their research. Writing grants, explaining their findings and their goals is how they compete for funding from various entities, including the government.
I'm implementing a new algorithm.
Hoang and her collaborators have been awarded 3 grants.
So I think surgery went well.
Dr. Hoang hopes within 5 years that these micro robots may be able to begin helping the humans she treats every day.
I definitely want to keep doing engineering and bring that marriage between engineering and medicine together to make better devices for patients and new discoveries. People ask me, am I putting myself out of business? And I always say, I hope I am the person to put myself out of business.